Now coming to some of the electrolyte imbalances. What happens to ECG in some of the electrolyte imbalance? We are going to primarily concentrate about sodium, calcium and potassium. Out of this, the most important electrolyte is potassium because this is the one which can influence the electrolyte imbalances a lot, like RMP a lot, because in RMP chapter itself we saw this is the one which is contributing to the RMP, and any change in the potassium will definitely implicate the electrical activities. So potassium changes as such, when you see the patients also, both hypokalemia and hyperkalemia has to be identified in time. So coming to hyponatremia and hypernatremia, these are the blood levels. So as such, whenever there is elevation of sodium or a reduction in sodium levels, it is not influencing the ECG so much. What happens in hyponatremia is all waves are smaller. Nothing much severe happens, but little change can be there. Then hypernatremia, what happens? There is not much of change. ECG, no changes are seen. So generally the ECG is not affected by hyponatremia as well as hypernatremia. Now coming to the calcium levels. What happens in hypocalcemia? In hypocalcemia, what happens is there is a QT prolongation. Usually we can see a QT prolongation. This QT prolongations can be seen in hypocalcemia. So if they give some symptoms of hypocalcemia and finally there is a QT prolongation, then it is most likely a hypocalcemic condition. They will give symptoms like what happens in hypocalcemia. We can have something called as hypocalcemic tetany or Chostek sign. So whenever the calcium level goes below some limits, there is hyperexcitability. So this QT prolongation can be another sign which is given in hypocalcemia. And what is hypercalcemia? What happens? There is shortening of QT. So first thing is there is shortening of QT. And there is a notched segment in the QRS complex. This can be seen. The QRS complex usually goes like this, but at the later half of the QRS segment, there can be a notch like this. This notch is represented as J wave, or it is also called as Osborn wave. It is also called as Osborn wave. These two changes, if they indicate, then it is most likely a hypercalcemic situation. Even in hypothermia, this Osborn wave can come, but electrolyte imbalances, it is happening in hypercalcemic levels. Then coming to the most important discussion, that is a hypokalemia and hyperkalemia. So what happens in hypokalemia? Hypokalemia and hyperkalemia, both of them will affect the repolarization first. Repolarization first, because potassium levels are important for the repolarization. So they will be affecting the repolarization. What happens in hypokalemia is there is a presence of QRS complex, but generally the T wave is depressed. And following this depression, we can get one more wave which is called as the U wave. There is a depressed hypo, just remember it is decreased. Hypo is decreased, so there is a decreased T wave. So that will be the mnemonic. So there is depressed T wave, depressed T wave. And there is one more additional wave which is present in hypokalemia itself, that is nothing but a U wave. U wave, it is not compulsory, but it can be present. Now coming to hyperkalemia, whenever the hyperkalemic levels are increasing moderately, there will be changes seen only in the T wave. But later on, other waves also will be infused, like other parts of the heart also can be influenced. So what happens initially? The hyperkalemia start, the first change that can be noticed is, here we have seen a depressed T wave. There what we will see? We will see a tall T wave. The T wave will be tall. In case of hyper, you remember it is increased. So T wave will be tall. Tall T waves will be present. The second feature is, as and when the disease progresses, what can happen is there is widening of QRS complex. Tall T wave also will be there, and widening of QRS complex. So this will be the second feature, which is widening of QRS. Then coming to the third feature, what is going to happen is the atria will go for an arrhythmic kind of beating. Atrial fibrillation will happen in case of hyperkalemia. So that's why hyperkalemia is a very dangerous condition, very serious condition. What happens in hyperkalemia? Atrial fibrillation is happening. So will you find an A wave? If it is fibrillating, it means that it is shaking. So it is not producing any wave at all. Proper waves are not formed. So what will be there? There will be an absent A wave. So there will be an absent A wave. So this can be there. absent P wave, atrial fibrillation, absent A wave will be seen in the JVP. Here it is the P wave will be absent in severe hyperkalemic conditions. So in hyperkalemia, what is the primary treatment? Hyperkalemia means there is increased levels of potassium in the blood. It is a very dangerous condition. So what we have to do is we have to eliminate this K plus from the body. Ideally, the kidney eliminates it, but severe hyperkalemia, the kidney cannot eliminate all of them at once. So what we do, we try to send them inside the cell. From the ECF, we try to send them inside the cell, that is the ICF, intracellular fluid. So this can be done with the help of a drug or a substance which is used in diabetes, that is insulin. Insulin, what it does is it can activate the sodium potassium ATPase. This is very, very important for clinical purposes also, the sodium potassium ATPase. So whenever you give insulin, what will happen? This K plus will enter the cell and it will be there inside the cell, and after some time they will be slowly excreted from the cell so that the kidney can eliminate them over a long time. We are trying to avoid the imminent danger of this hyperkalemic levels. So whenever you give insulin, the patient, ideally he might have died due to hyperkalemia, but you give too much of insulin, what will happen? The patient might die to hypoglycemia. So what we have to do, along with insulin, we always have to give dextrose, that is the glucose. So insulin dextrose has to be given for hyperkalemic patient. This could be a life-saving procedure, and whenever you see a tall T waves, it is an emergency. We should try to treat the patient as early as possible so that they can be saved. It is a simple treatment and it can prolong the life of a patient to many years.